Hello everybody, this is Suzanne Conversation with Dawning Visions Hypnosis. I have a very important question for you today. Are you thinking of leaving the mental health profession? Because there are a lot of people who are. And the sad thing is that there are so many people these days who really need your services, especially our kids, who are having a really difficult time, especially after all the COVID mandates, the lock-ins, and doing Zoom classes and having parents who are feeling overwhelmed, trying to do their jobs as well as educating their kids. It was not a good time, along with the masking and all the rest of it. So the question is, how can you create a practice that actually works for you in a much better way? Because I do have trainees who have decided, some of them actually did leave the mental health profession and turned it actually into coaching practices so that they're no longer being handcuffed by the rules and regs of the associations, no longer dealing with all the paperwork and the low pay from the insurance companies, and basically getting paid, I don't know, $400-500 an hour. Actually, 45-minute calls is usually the average for coaching call, while they choose their own clients to work with. Now, I'm not saying this is something that you have to do, but I certainly did have one PhD licensed psychologist who stopped her practice. I don't know if she sold it or just stopped it, but this is exactly what she did, and she's doing amazingly well and having a much better time in her practice on all levels. I have other trainees who just want to learn how to be more effective with their patients in terms of truly helping them heal instead of managing symptoms and dealing with the side effects of medication, in which too many patients state that their antidepressants do little to nothing to help them out and have a lot of side effects. And if you actually look at the research that Dr. Irving Kirsch out of Harvard University did and Dr. Walter Brown out of Brown University duplicated as they were studying placebo effects, you will find that these medications really do not do what they need to do. And there's actually been more research coming out proving that the whole chemical imbalance concept is totally wrong. No one is missing synthesized serotonin, reuptake inhibitors, etc. You need to help your patients get to the cause of their problem, the purpose why they're holding on to their problem, even though the dysfunctionality demonstrates that the defense mechanism has outlived its purpose, and to help them find their compelling future, the reason that is so compelling that they're willing to let go of their illness and move on to having a happy, contented life. All things that I teach in my 2-day VIP training with 12-month mentorship, along with helping you integrate hypnotism and neurolinguistic programming into your healing protocols. Because it is truly through the mingling of the brain and the hippocampus where the emotions are found to be, that we're able to help our patients and clients to release all of their symptoms, therefore letting go of their illnesses in 80 to 90% of the clients that I've had for the last 20 years. Because the reality is that they don't have to manage symptoms, and they do not have to take medications forever. Not if you know how to actually help them to transform their dysfunctionality into life-giving functionality, along with a compelling future. So if you're interested in learning more about my 2-day VIP plus 12-month mentorship program, I'll leave the contact information in the description below so that you know how to contact me, and we can have a video call and I can answer all your questions. And if it is something that you're interested in doing, great. I only take on one trainee a week because I have to mentor all my trainees, right? If they have issues, they're going to need to ask questions. That's the whole point of the mentorship, right? Just like your clinicals when you went through your mental health training process. So you have to be reasonable in terms of how many people I can actually mentor at any given time. That's all I have for you for tonight. Thank you so much for taking your time with me, and I'll talk to you later. Bye-bye all.